Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the anatomy of the spleen. Right, so what is a spleen? So spleen is the largest lymphoid, secondary lymphoid organ in the body. It is the only lymphoid organ that is involved in the filtration of blood, and it is located right in the left hypochondrium. Right, so it is going to be, it's a purplish reddish organ that is involved in sort of like it's the graveyard of red blood cells. So it destroys red blood cells, and then it detects and recycles the heme and the iron and so forth. Right. So gross anatomically, the spleen is found in the left hypochondriac, like I have said, and embryologically is going to be formed in the dorsal mesogastrum of the stomach, and via the rotation of the stomach, the spleen is going to be carried to the left. Right. What is anterior to the spleen? So you're going to have structures like the stomach, structures like the liver, structures like the diaphragm and the pleura, and the skin. They are going to be anterior to the stomach, and then posterior to the stomach, you're going to have the costal cartilages of rib number 9 to rib number 11, right? So rib number 9, 10, 11. These are the ribs that form that are posterior to the spleen. Take note of this, NB. The spleen is not clean in the clinical examination. You cannot palpate the spleen. Uh-huh. The spleen cannot be palpated in a clinical examination. It can only be palpated in an abnormal condition, for example, in splenomegaly. Right, we're going to talk about it very soon. So it is found in this region, and it is going to be attached with, um, with the ligament. So you're actually going to have your spleen. You can actually see your spleen here. It's going to be attached to your stomach. Let me look for a diagram that shows these ligaments for you. Right here, so this is a ligament that connects the spleen to the stomach, which is called the gastrosplenic ligament, or the gastro lienal ligament. Right, so it is a ligament, but within it you're going to have blood vessels. Right, for example, the splenic nerve, the splenic vein, the splenic artery. That will be coming from the celiac trunk, as you're going to see, will be within this gastro splenic ligament. Let's take a look at another ligament of the spleen that connects to the kidney. Right, so this another ligament that is called the splenorenal ligament that connects the spleen to the kidney, which is the left kidney. Take note, it also contains the tail of the pancreas. So that's why we say the pancreas, um, uh, the body, the head, the neck, and the body of the pancreas, they are retroperitoneum. But as for the tail of the pancreas is intraperitoneum because it is found within the splenorenal ligament. Good. So these are the two ligaments that you have. So the splenorenal ligament attaches the spleen to the kidney, and the uh, uh, splenic ligament attaches the spleen to the fundus of the stomach. Let's take a look at the blood supply to the spleen. Right, so the spleen is going to receive its blood supply from the splenic artery, which is a branch, the largest branch of your celiac trunk. So you can actually see that this is your splenic artery posterior to the stomach, highly tortuous, and then it's going to give about five branches that will get into your spleen, right? And also give some branches, remember, that will become your short gastric artery, and give also another branch which you call the left gastro-omental artery, which anastomosis with the right gastro-omental artery at the greater curvature of the stomach. So that's the blood supply of the spleen. Right, so let's take a look at the venous drainage from the spleen. So you understand that this is the hilum of the spleen. So you're going to have also veins coming from the spleen itself which we call the splenic vein, and it is the splenic vein, right, where the short gastric vein and the late gastro or mental vein are gonna drain in, and then this splenic vein behind the body of the pancreas is going to meet the inferior mesenteric vein, and behind the neck of the pancreas is going to to meet with the superior mesenteric vein and form the hepatic vein. Let's take a look. The hepatic portal vein. Let's take a look right here. So you can actually see this here, your the splenic vein, right? And then it's going to receive tributaries from the short gastric veins, right? And then also a tributary from this one, which is your greater your greater omental vein, and form this splenic vein. And behind the neck of behind the body of the pancreas, you have the inferior mesenteric vein that will drain into the splenic vein, and then the splenic vein behind the neck of the pancreas is also going to join the superior mesenteric vein, forming the hepatic portal vein, right, which is very important. Right. So, what about the lymph drainage? So, the lymph of the spleen is going to end up into the celiac lymph nodes, and from the celiac lymph nodes, we get into the intestinal tract. From the intestinal tract, we form the cystina chyli, and then now we have our thoracic duct. Simple. Then about the venous supply or the innervation, the spleen is going to receive innervation from the celiac plexus. Right. So I want us to take a look just on the splenomegaly. Right. So splenomegaly, it is the enlargement of the spleen. So remember, the capsule of the spleen is a smooth muscle. So the spleen has the ability to enlarge and to expand to enlarge, right? And then it is the smooth muscle that will contract and keeps the spleen in the right size, right? But in abnormal cases, you can have splenomegaly that can lead to the rupture of the spleen. Since the spleen is the reservoir of red blood cell, it is actually a critical uh, condition when your spleen ruptures, because you're going to have a lot of blood um, entering your peritoneal cavity. But an important clinical uh, correlate, correlate is this: the anterior border of the spleen and notched border, the anterior notched border of the spleen, is actually palpable only in abnormal cases, only in abnormal cases. And it's palpable when the patient under this um, undergo operation, and then this anterior notched border is going to be palpated, right? So another the last uh, um, thing that I want us to talk about the spleen is the surface of the spleen, right? So we have a convex surface, and then we have a concave surface, right? Superiorly, we're going to have a diaphragm. Inferiorly, we're going to have the left colic flexure, which is even named uh, the splenic flexure, right? Of the what? Of the colon, right? So you're going to have uh, deformities, or let me say uh, some some um, some deformities, some shapes, right, that are formed in the right in the concave surface of the spleen. So let's take a look at these deformities, right? So this is your hilum, right? Um, this is your hilum where your splenic vein and is leaving, and your splenic artery is entering. um, Hilum. Good. So you're going to have your gastric area. So this impression is made by the fundus of the gas of the stomach. You're going to have your renal area. This impression is made by the left kidney. And then you're going to have your colic area. This impression is made by the left colic flexure. Right. So it's actually very important to understand these these areas, right? These impressions, these deformities on the concave surface of the spleen. So thank you so much, guys, for listening. Today's lecture. See you next time and take care.